talking about what's happening with COVID, nothing but COVID. And in our show, too, we just talk about COVID all day long, and everybody else is talking about COVID. Dr. Lowe, welcome to Radio Saaz. Awaz, how are you?
Wonderful. Thank you so much for having me. And I'll let you know, hopefully one day we'll be talking about other things besides COVID.
Yeah, you know what? I keep my fingers crossed, and that's the first question I was going to ask you. How long do you think that we'll be talking about COVID?
Well, so it's interesting. I think we're continuing, and especially it's very important for everyone to really continue with the staying at home right now. Just our levels of transmission are really high, and in order to keep people safe and in order to make sure immunizations will have the best effect, we want to try to keep levels low and bring them down. So definitely staying home, not meeting with people outside of our household, and if we do have to meet with people outside of our household, distancing, masking, all that other stuff. Hopefully that'll keep things down till the spring when more vaccine will come, and then after that we'll start to see a change in the transmission picture.
डॉक्टर लॉरेंस लो जो कि पील के लोगों को सेहतमंद रखने में मददगार और माविन यानी continuing his work to help people of the Peel to live the best, healthiest and the most enjoyable lives. Young man, Dr. Lawrence, now one of my question is, yes, the expected or predicted number after the Christmas was around 10,000, which is far less, and today it is around 2,500 or 100 people, although tests are not conducted as much as day before. But now the situation is becoming more and more critical because they don't have place to accommodate people in the ICUs. Although this number is not still 1/4 of the predicted number, what would you say?
I think it really speaks to the need for us to try to bring the cases under control, because we know that cases ultimately become hospitalizations, and hospitalizations ultimately become people in ICU, and sometimes people do succumb to the disease, unfortunately. And so I think if we can keep transmission down, hopefully we will keep ICUs down. In the meantime, our hospitals, I understand they are continuing their surge capacity plans, so they have been reducing surgeries. They've been treating patients in all kinds of parts of the hospital, and they're looking at field hospitals as well. So, there's a lot of capacity being brought online, but it won't be helpful if cases continue to stay too high.
Understand, and I think Dr. Naveed was with me other day on Friday, and I was told that even though some things are available, the staff is not available. They don't have enough nurses. Now, in the emergency scenarios, in emergency conditions, sometimes the army get into, and but there is no army nurses, and the doctors are still involved in these operations at the province level. Is that right?
Yeah, at this point in time, there hasn't really been any need for military assistance at this time. Certainly, at least in long-term care homes, that has happened in the past.
Yeah.
And if the situation continues to worsen, then I'm sure that it will happen. But I know that in Peel, we have a very good integrated partnership with our hospitals and our long-term care homes and our Ontario Health teams, and hopefully the situation will stay under control.
Dr. Lawrence, now over the weekend there was what is that blitz something where they went to 240 big box stores, and around 23 were given ticket, 26 were given notices. What is this? Is something that people are sick and tired of sitting home? Why people are not following what the government is asking them to follow? Stay home, don't go out, and now that they're issuing tickets as well. What is the problem that people not understanding how severe the situation is and how critical this second wave is?
Well, I think the tickets that were issued to the stores were just in recognition that people still can go get essentials like groceries and medications, that kind of things. But a lot of these stores, they have to make sure that people are distancing and masking when they are in there. So that's the tickets on that front. But to the question about people, I get it. I think a lot of people are just very tired. They kind of just want their lives back. I think all of us do. And so, I think the only thing I can tell people is, just hold on for another few months until the vaccine starts to come through, and then we'll really be able to hopefully start to get back to some sort of normal. But for now, stay home is the key message.
So this means, Dr. Low, now the essential workers are getting this vaccine, and I believe by the beginning of the March or the end of the March, they will start this for the elderly people. What do you think it will be available to the ordinary people? And when this cloud will go away, and you think and you feel that we will be out of this situation, some security level?
Well, the federal government obtains the vaccines. They're the ones that buy the vaccines, and they give them to the province, who is in charge of allocating the vaccines to different communities. And then for us, we are the ones that roll it out to the community. But the priorities are set by the provincial government. And what I understand is that we are expecting the vast majority of our vaccines to come in April through June, which means that for the time being, in the first quarter, vaccine is still not yet available to the community and to members of the public. And especially with the Pfizer slowdown that you've probably been seeing in the media, it's going to be even longer before we start getting it. But hopefully by March, we have a lot more vaccine coming in, and by April, May, and June, we will be seeing mass community vaccination occurring.
So in other words, the vaccine will be available to everybody, most probably May and June, God willing.
Hopefully, if there isn't any other changes or delays, and the federal government schedules holds up, then it will be in the spring that we'll see most people having access to the vaccine, hopefully.
Now for example, in one car, if the people from the two balloons come and sit together, what do you advise to give them ticket and heavy tickets? What will be your advice?
Well, I think the biggest thing is just everyone has lots of challenges, and I would say the big thing is just to really make sure, if you are meeting, you make sure you're meeting for an essential purpose. And if you are, whenever you do get together with someone outside of your household, make sure you're keeping your distance, make sure you're wearing your mask. If it's not possible, such as a carpool, etc., then you have to try a different sort of approach, obviously. And if there's any help that can be given, we continue to ask for help for essential workers in our community, for paid sick days, more worker protections, more resources and support. So hopefully there will be more of that coming from our other levels of government as well.
Dr. Lawrence Low is with us, Peel Medical Health Officer. I know he's very busy. I have one last question. Majid might have another one. Now, Peel is always number one. Of course, Toronto is the number of the patients in Toronto was much higher. Then comes the Peel, and then comes other areas. What is, although the community in Peel is far more less than the community in the Toronto area, what is the reason that the number of patients is not coming down in Peel area?
Well, the story of the region of Peel is a story of disparity, and we have a lot of essential workers that are working in places where they can't work from home. We have a lot of those people who also live together in crowded or living settings, crowded homes. And so what happens is you have this transmission that occurs in workplaces, and then back into households, and then back into workplaces, back and forth continuously. Whereas in cities like Toronto, and even in parts of our region, there's some cities that there have more people working from home than others. So that's why you see a difference even within our region between the municipalities, right? So I think the biggest thing that we have to remember is, for everyone in Peel who can, now is the time to stay home. Now is the time to limit your contacts. Don't attend or hold any social gatherings. And for essential workers, we absolutely need help from the provincial government and the federal government for paid sick days, for worker protections, more workplace inspections, rapid testing in workplaces, so that we can address transmission in those settings for people who can't just stay at home voluntarily.
You analyze in such a the best possible way. To be honest, I always ask myself, I live in Brampton, that when I enter on 410 and it is always so busy, and I thought, and you said very well, and of course you opened my eyes that in Toronto people are working remotely, whereas in Brampton and in the Peel area people have to go to the workplaces. Beautiful, Dr. Low. I thank you very much for being with us. Any advice for the people?
You know what, like I said, I think the big thing is if you can stay home and you can limit your close contacts, that's the best thing you can do as we get through this second wave. And I would just also urge people, take care of yourselves, connect virtually with your loved ones, certainly be kind. We know these are very difficult times in the middle of winter, but we're going to get through this. I think we're going to be just fine, and I really thank you for having me on the show today.
Inshallah. And Doctor, while you are present here, I was reading certain articles. There is, with this, there are after effects of COVID are very bad. It on your hair and everything. Is that right? Because when we read these data, it tells us that there are side effects which stay with us for the life. Is that right, doctor?
It's still being studied because it's kind of crazy to think, but this is a disease that we've only known about for just about a year now. So we're still learning a lot of different things about it, and really the best way to avoid finding out personally is to just make sure you're sticking to the precautions and not getting it in the first place.
God bless you, doctor. Thank you very much for being with us. We look forward to talking to you again. Thank you.
I'd be happy to be back. Thanks so much.
Thank you. डॉक्टर लॉरेंस लो हमारे साथ थे, और ये आप इसको रिसर्च को पढ़ के देखिएगा, बस आई ओपनर थी कि जब जिन लोगों को कोविड हो जाता है, कोविड के बाद के इफ़ेक्ट्स बहुत बुरे हैं, और जो लाइफ लॉन्ग फिर हमारे साथ रहेंगे, किन एरियाज़ को कैसे इफ़ेक्ट करके जाएगा. तो बहरहाल, दीज आर फ्यू थिंग्स.